Hello, this is Chandra, your disabled bestie. I just wanted to kind of begin to offer a glimpse into my everyday life as far as what I deal with, doctor's appointments, procedures, etc., that surrounds my disability. As you know, I have multiple myeloma, which is a form of bone marrow cancer. It is incurable. So I will have it for the rest of my life. There is no way that I can be without this cancer. I am currently in remission, have been in remission since January 2019. And since then, I've been taking maintenance chemotherapy. And the idea is to give me lower dosages of chemotherapy in order to keep me in remission. And for the past 7 years, it's been successful. My numbers are good. They monitor my cancer levels through my blood. And I just met with my oncologist last week, and my numbers are good. Now, this is the conundrum I'm in. Currently, how I do maintenance chemotherapy, I have to go twice a month. So in the course of 1 week, I have to go, say, on a Wednesday, give blood, and that's how they determine, my numbers, and they can okay my chemotherapy. Then I return to the cancer center on Friday, wait for them to give me chemotherapy. It's not through an IV, it's an injection, it's just a shot. So it doesn't take very long. I have 1 week off, and then the following week I do it again. Go give blood, and then go get my injection a couple of days later. Now, I've been doing this for 7 years, and right now the problem is I'm tired. Like, the way that maintenance chemotherapy is going right now requires me to go to the cancer center 4 times a month. And when I stayed on the north side of Jacksonville, that was okay because the cancer center was 12 minutes away. Now that I've moved, the cancer center is 25 minutes away. So, and then the price of gas is $4 a gallon. So last week when I was meeting with my oncologist, we were discussing, like, is there an alternative maintenance chemotherapy that I can take that would not require me to come into the cancer center as much? And then that's when he offered the idea of an oral chemotherapy. So essentially, I'll take pills 3 weeks out of the month. 1 week, I don't take pills. One time, I have to visit the cancer center in the course of a month to give my blood. And then I will meet with him regularly every 3 months. So this would be a lot of, this won't be as taxing on me as far as having to go repeatedly to the cancer center, 4 times a month, versus I will only have to go 1 time a month. Now, here's the conundrum, and this is where I want your input. The chemotherapy that I take right now is called Velcade. It comes in an injection. It is very effective. Now, there is concern with my oncologist that maybe the oral medication, which is called Revlimid, may not be quite as effective. So, as a precautionary measure, he had me get what is known as a bone marrow biopsy. And essentially, what that is that you go into the hospital, they give you sedation, Versed, and fentanyl, and then they take a hollow needle, put it into your hip, drill down in your hip essentially, and suck out the bone marrow. And then they will take the bone marrow and do genetic testing on it to basically see how compatible it would be with the oral chemotherapy. So the thing is that, like, yes, I'm on a medication that works really well, that has done me right for 7 years, but I'm tired of the process of getting it. And then, or should I try this other medication that is oral and will only require me to go to the cancer center once a month? So that's where I want your feedback. Because my initial gut reaction is, of course, I want the absolute best medical care I can receive against my illness. But there is a balance between, the physical toll that it takes for you to carry yourself through these appointments. So let me know your feedback about that. But another thing I wanted to say, I got the bone marrow biopsy this morning, and they gave me an IV. And like I said, they give you Versed and fentanyl as a sedative. It's supposed to serve as a twilight anesthesia. Let me tell you, the dose they gave me, I felt absolutely nothing. It did not sedate me. It did not relieve pain. I was on the table as they were basically going into my hip bone. I'm moaning and whimpering because it is so painful. And I just think it was a little haphazard that they did not take into consideration that I have been disabled for 16 years and am on a lot of heavy medications, which can affect the ability for other medications to work on me. So essentially, they didn't calculate the dosage of what it would take to make this procedure easy for me. I basically went in without any painkillers or any anesthesia. So that's my little gripe there. But your feedback is much appreciated. Thank you. This is your disabled bestie, Chandra. I'll see you later.